Hello viewer, hujambo. Welcome to this GTN Nursing Services where I, Grace the nurse, talks about mother and child health care. It has been a while. I hope everyone is okay. So today, as usual, we usually have our reference book, which usually gives us a talk. And today we are on page 8 of 44. Page 8 of 44 is this one. And our interest is on the last column, whereby it is talking about mental health assessment. So this means that when you visit the clinic, everything else is checked, it is recorded, including the status of mental health assessment as per the nurse who has been attending to you. So how is it usually done? Let's see how it is usually done. But before we see how it is done, let us first of all understand how transitioning to motherhood affects a woman. So our topic today is on transitioning to motherhood, a significant period for a woman. Let's go. So we are told that our learning objectives of today include understanding how motherhood transforms a woman, understanding the purposes of mental status assessment, like we have been told in the booklet. So by the end of this learning session, we will have understood the purposes of mental health assessment. We'll also cover the perinatal mental health conditions, which are these mental health conditions. And then number 4, we'll have to understand the risk factors to developing mental health conditions. So 4 learning objectives. So objective number 1, about transitioning to motherhood. We are told that pregnancy, childbirth, and parenting brings about a significant change in a woman's life. Most women will be challenged by the adjustments required to settle into motherhood. Although usually a time of great joy, it is often accompanied by some levels of stress due to hormonal changes. Yes, it is also accompanied by lack of sleep and physical and emotional adjustments that occur during the perinatal period. So there are some physical and emotional adjustments that also occur during the perinatal period. So these are the things that makes a woman be transitioned. So we are told that these feelings, the ones we have covered there, are usually transient and with adequate rest, reassurance, and care by health professionals and family members resolve early in the postpartum period. Okay? Those things that we have seen there, that they are being triggered by pregnancy, they are usually transient and with adequate rest, reassurance, and care by health professionals and family members, they resolve early in the postpartum period, that is immediately after delivery. The ability to adopt smoothly into parenthood is not only influenced by a woman's mental health, but by her social support network. Do you have one? Social support network. And ability to recover physically from pregnancy and birth. Your own physical strength that will make you recover from pregnancy and birth. All those will help you to transition into motherhood. So there are things to note. So when it comes to stress is a positive and a normative response of having to care for the newborn. Hypervigilance from our new mother keeps the infant safe and secures the mother neonate attachment and the bonding process. Significant hormonal changes post-birth, particularly the first week, can result in fluctuation of mood, and many women report feeling weakness, yes, and overwhelmed by being transitioned into motherhood, hence the purpose of this talk. So I'm here to support you during this time of transitioning, so welcome. So the purpose for mental health assessment. Yes, we have seen the booklet that when you visit you remember the social network we are told, and the help by the health professionals. Yes, so the reason for the perinatal mental health assessment is perinatal mental health conditions are on the increase and are of global concern, and therefore they require competent and supportive maternity care to identify, monitor, and effectively treat to improve mental and infant outcome. Okay, the purpose for perinatal mental health assessment is because they are on the increase and are of global concern, and therefore they require competent and supportive maternity care to identify, monitor, and effectively treat to improve mental and infant outcome. Perinatal means from conception to the first 12 months of the baby's life. Remember we mentioned this word perinatal before? So perinatal means from conception to the first 12 months of the baby's life. We are told that the typical onset for mental health issues is during late adolescence and to the early mid-20th years of age. Yeah, typical onset for mental health issues. We were talking about purpose for mental health assessment. Yes, and we are told that the typical onset for mental health issues is during the late adolescence and to the early mid-20th year of age. If not noticed and treated, they develop into more severe disorders in later years. And women who have a history of anxiety, depression, or other mental health conditions, the transition to motherhood may spiral her emotional well-being into maladaptive responses that may lead to self-harm or to the baby. This is what they call suicide, self-harm to the mother or to the baby. Mental purpose for mental health assessment continues. We are told that midwives and nurses have a pivotal role in acknowledging and respecting a woman's unique set of circumstances, while assisting her to transition into motherhood by 1. Fostering resilience. When you go to the clinic, the midwife or the nurse who attends to you, she's supposed to have a chat with you, sweet talks, so that she can foster resilience to you.